This is Dr.Remya Krishnan, and I am today addressing a very serious problem in today's BAMS curriculum, Ayurveda professional curriculum. The grave mistake, one grave problem which is identified is this: there is no Ayurvedic research methodology which is educated in the curriculum, and no Ayurvedic research methodology is adopted in conducting research of Ayurveda for Ayurveda community. So I don't understand, despite of Ayurveda Samhidas, our most authentic textbooks of Charaka Samhita, Ashtanga Sangraha and Susruta, especially Ashtanga Sangraha and Charaka, have described such a brilliant methodology of research in Ayurveda, pharmacognostical research and clinical research, both the ways. So even though it is explained so detailed, like the objective, right from the objectives of research, methodologies of research, what are the standards, parameters of research, standards of research, rational standards of research, all these are explained in the curriculum, in the Samhitas in detail. But despite of having all this in Samhitas also, they are not translated into modern disease care requirements in society. Like, for example, what is the objective of research in Ayurveda? The objective of research in Ayurveda is not new drug development. The objective of research in Ayurveda is to identify the exact diagnostic and treatment principles to reverse the conventional diseases. How to understand conventional diseases, which can be classified under different categories like infective diseases, inflammatory, metabolic, immune dysfunction, hormonal disorders, etc. So based on this category, how to classify, how to understand each of these categories. Infective diseases, how to understand. Inflammatory, how to understand. That too, different types of inflammation can happen by exogenous causes as well as endogenous causes. So how to understand the nature of inflammation in Ayurvedic perspective, how to understand the response, what to do, which logic is to be applied in this particular cause mechanism of inflammation or infection or hypersensitivity or autoimmunity or type 2 diabetes or hypothyroid or dysfunctional uterine bleeding. Such a kind of research, both basic and applied research, even though the inputs, the what all guidelines, there are systematic ways explained in the science of Ayurveda regarding how to do research in the patient, research in the disease, and research in the treatment. These three aspects are discussed in the science. But still, despite of having all these in the textbooks in the sense they are complete, they are like the textbooks do not merely explain some medicines and their uses. Ayurveda Samhitas are explaining the methodologies, the diagnostic and treatment principles, guidelines, protocols, how, what, where, when, why not, cause mechanisms, right from starting from fundamental biology, Ayurvedic biology, it begins. Such an elaborate description is given in the Samhitas of Charaka, Susruta and Ashtanga Sangraha. Despite of having all this, what we are doing right now is we are learning biostatistics and research methodology of modern medicine to do the research in Ayurveda. How insensible it is. What is the use of doing that? Actually, biostatistics and research methodology is intended to develop new drugs. For them, it is new drug development that matters. It is not. The objective of research in Ayurveda is to attain pradipatti jnana. Pradipattir nama yo yadha pradipattavya tasya tadha anushtana jnanam. Which logic, when you apply in what means, it will reverse this cause mechanisms of particular disease. Understanding that logic, exploring that logic, translating that logic effectively into contemporary clinical care situations or clinical care necessitated situations. That is called translational research or applied research. This is what is required in Ayurveda today, and for that, biostatistics and research methodology has absolutely no role. Why? Because Ayurveda, the treatment principles or diagnostic principles are intended to confirm the diagnosis and treatment. It's not like basic what you call benefit risk ratio. Unknown compounds are not prescribed. There are more than enough medicines, recognized medicines, scientifically recognized evidence-based medicines in Ayurveda. So we don't want new drugs anymore. What we want is new intelligence to understand the working of these logics and effective implementation of these logics through accurate medicines to intervene upon contemporary healthcare situations or healthcare requirements. So for that, physician intelligence is to be cultured in the knowledge and practice of science-based medicine. For that, research is intended in Ayurveda, and there are specific methodologies and principles which are explained regarding how to conduct research. Quality control procedures, definitely modern technological aids can be used to ensure the quality of the drug and formulation, to ensure that there is no adulteration. So in pharmacognosy, it is all right to adopt the technology and to understand and evaluate and assure the quality standards of the formulation or single herb or whatever it is. That is fine. But while coming to clinical application, why Western medicine is doing this kind of research? Because they need some kind of evidence to prove that their drug has some working principles, like it benefit risk ratio, it can produce this much benefit, this much risk, because it is an unknown compound. But in Ayurveda, only evidence-based formulations are there. Evidence in the sense where to apply, why to apply this, how to apply this, and you have to consider what all aspects while choosing this medicine, based on what logic you are choosing medicine and why any particular medicine and why. All these are explained in Ayurveda. So the formulations which are explained in Charaka Susruta and Ashtanga Sangraha are evidence-based formulations. But these evidence leads are to be rightly applied. It's like lock and key mechanisms. Many times there will be no need of medicines. Only with logics we can modify the lifestyle of the patient and attain fast and intended results in acute conditions. So what is more important is understanding more than discovering in Ayurveda. In Ayurveda, the basic and applied science is to be comprehended in the deepest level. And that is what is called research in Ayurveda. It is not like new drug development in modern medicine. They need some external evidence to integrate with the formulation and call it as evidence-based medicine. That is not the situation in Ayurveda. In Ayurveda, evidence-based medicine is science-based, primarily science-based. And what is data showing? Data will be showing whether it is giving intended effects. It is like mathematics. Ayurveda is a deterministic science. There are no theories in Ayurveda. There are only theorems, laws and principles in Ayurveda. So it is already proven and established. The science is proven and established. But what is to be proven and established is judicious application. That can be done only by applying the rational standards of the science and not statistics. So when we are applying the rational standards of science, only two kinds of results are possible. If the logic which is chosen is correct, 100% it is intended effect. The logic is wrong, 0%. There is nothing like 60% benefit, 40% risk. It is not Ayurveda. Ayurveda is such a science where it is whether it is intended effect and health. If intended effect and health is not happening, the logic chosen is wrong, or your application of the logic is wrong. So you have to go back to the principles of practice of science-based medicine. Such a kind of attitude and approach is explained in Ayurvedic research methodology. So instead of doing that, when you prescribe, when you do this kind of modern research methodology and you develop new and new drugs, what is the use of all these new drugs for Ayurveda physicians, especially when hundreds and thousands of Ayurveda formulations and their judicious application is unknown to Ayurveda community. Are we going to look into the reports of benefits and risk to choose the treatment for our patient? Are we going to see the PubMed reports or journal reports or some search engines? Are we going to depend on any search engines to identify what is best for your patient? In modern medicine, it is like that. Their research evidence is obtained from data. So, are we going to adopt the same thing? What for Ayurveda doctors are foolishly encouraging this kind of blind research methodology of like blind in the sense for modern medicine they have their own explanations. That is fine, they have no other means because their science is medicine based science. It is not science based medicine. Anatomy, physiology, pathology, etc. are there on one side. But when they are choosing medicine, they are not depending on anatomy, physiology, pathology, etc. They are depending on only data, evidence based medicine. Of course, clinical knowledge of the physician is important, but most importantly they are considering research data, research evidence, and for that they are doing this biostatistics. They are adopting, they are conducting randomized control trials with unknown compounds, and they are comparing with another standard formulation with more benefit, less risk, previously approved formulation they are comparing, or with placebo they are comparing, and what they are evaluating, whether benefits are more or risk is more, that they are evaluating. What is the use of doing this kind of blind, foolish research in Ayurveda? It has been nearly 70-75 years now that we are blindly following what they are doing. And sometimes we are blaming them, we are condemning them also. These people, they are not, when they blame us regarding heavy metal poisoning, again we will be showing when they call us, or when conventional society call us, we are unscientific. What we are trying to prove, instead of trying to prove the innate scientificity of our science-based medicine of Ayurveda, what we are trying to, I feel very ridiculous. Ayurveda doctors and so-called scientists are telling, we have published that article in peer-reviewed journal, Nature or other journal, this journal, that journal. These biostatistical reports of everything based on formulation reports are being published in peer-reviewed journals based on this erroneous evaluation with biostatistics instead of applying Ayurvedic science-based medicine research methodology. Then what is the value for such kind of reports? Are we able to prove or substantiate the scientificity of this brilliant system of medicine by doing this absurd approach? Please think, my dear friends, it is like, this is so shameful. This is so shameful. We are teaching students modern research methodology just for the sake of showing off something that we are also learning. Fine, for general knowledge it is fine. But what is to be adopted for a physician? To become a physician is recommended to be a scientist in Ayurveda. So for that, vital part is crucial clinical research methodology explained in Ayurveda. Every clinician is recommended to be a scientist in Ayurveda. It's not like theory separate and clinician separate. Only a person who is having very good command in the principles of science-based medicine can only become a clinical successful clinician also, scientific practitioner also in Ayurveda. So this is the basic thing which is recommended in Ayurveda. Shastra Artha Karmanushīlanena Samskruveda Prajñam. It is not Data Artha Karmanushīlanena. It is Shastra Artha Karmanushīlanena Samskruveda Prajñam. To improve the clinical proficiency, a physician has to continuously learn and practice the true intentions of scientific verses and not the interpretation of data by giving some unknown medicine or partially known medicine or known medicine in an aimless manner. So this is what I request each and every one of you to open your inward eyes and just evaluate what for we are wasting time. by learning this biostatistics and research methodology and completely abandoning the crucial Ayurvedic research methodology. Where are we heading to? We may publish many articles in many journals. We may get PhD also. What is the use of such PhD? What is the value of higher studies in Ayurveda by doing this kind of absurd and ridiculous research? What is the value? What you are gaining personally? Are you gaining any in-depth insight or creativity or deep knowledge in Ayurveda by doing such kind of research? Be honest to yourself. Just think. We have enough time to change. We have time to unlearn and relearn. Let us work hard. Let us be change agents. Let us keep telling this. Let us keep telling. Let us initiate. Let us make our voice and tell we are in wrong direction. If we are collectively doing this, there will be a big change in tomorrow, and that change will cause renaissance, scientific renaissance and revolution of Ayurveda. And there will be a day when Ayurveda will be addressed as mainstream medicine of India with clinically proficient scientific practitioners first in India. So with light of wisdom and justice only, we can abolish ignorance and injustice. Thank you. Thank you very much.